Hello and welcome to Our Experts Podcast. I am Carol Matichka, your host, bringing you fascinating perspectives from the world and realm of pharmacy. Well, hello. Today we have with us Dr. Madeline Camejo, Vice President and Chief Pharmacy Officer with Baptist Health in Miami Lakes. She is also the current FSHP President, and we are super excited to have you with us today. Welcome, Dr. Camejo.
Thank you, Carol. Thank you for having me on your show.
Absolutely. So tell us a little bit about yourself. How did you first become a pharmacist? What sparked that interest?
Actually, pharmacy is my second career. It was not what I had originally started off as. I was actually went to UCF for computer science and engineering and graduated. And when I came out, I got a job actually programming for the pharmaceutical industry, wholesaler at the time, Harris Wholesale, and started to work on automation for drugs. And that's how I was really introduced to pharmacy. We later had started to sell computer systems for stores and retail pharmacies, and it's where I fell in love with pharmacy. Decided when Y2K hit, it was so crazy then. I said, you know what? I really love pharmacy. So, actually went ahead and started to do my prerequisites and then ended up at Nova Southeastern and graduated from there.
Oh, wow. That's fascinating. My husband went to UCF in computer engineering too. So small world. So becoming a president of state organization, was that something you thought of when you first started with pharmacy? Was that even at the top of your list of things you'd love to achieve? Or was it kind of like what happened with me, which is things just happen one thing after another. You never know what's going to happen when one door opens, and just as long as you go through it, because you never know what's on the other end. Was it sort of like that, or what was your road like?
I'm not into what I call political. Even in school, I didn't, I was never class president. I always did everything else, but that, there are a lot of people who love that political leadership side of the house. But initially, I really just focused on operations, never considered this a choice. However, after building, several programs and realizing pharmacists could accomplish much more and coming up with more innovative ways to push the pharmacist, up to the patient, if we were given the opportunity, that's when I realized, well, we really don't have an opportunity. Legislation doesn't consider even paying for pharmacy services or anything. And really, that's when I realized, to make an impact, then it's essential to join organizations that are going to help advance the profession.
And at some point, you have to be the one to step up, I feel like. And if we don't do something, who will? And I always say that to our students too. It'll go by without us, and people will make the laws and our whole profession without us. So really applaud you, though, for taking that step and stepping up, because I know it's a lot of work. So thank you. And along those lines, we talk a lot about FPA, I think, on this show, but I really want our listeners to get to know FSHP as well. So can you talk a little bit about FSHP? Have you seen any big changes within the organization, or any changes in regards to the direction?
But absolutely, FSHP has always been a professional home for health system pharmacists in Florida. But, the last few years, we really tried to focus on transforming ourselves into a more agile organization. As you know, we are a state organization, but national policies also impact us in ways that sometimes we have to pivot to best serve the patients within our community. And now our councils are really hosting specialty-focused workshops throughout the year as well, ranging from like sterile compounding to updates to informatics and leadership skills. I think the biggest shift has been our intentional focus on elevating the pharmacist voice, not just within hospital walls, but the state and national levels. I really want to push so that all, including FPA, FSHP, collaborate so that we're no longer simply reacting to challenges, but together are shaping the future of pharmacy in Florida. And I think if we can unite with one voice, when you have so many different voices and so many different opinions out there, it really fractionates our voice and legislators don't listen. So it's harder for them to listen and understand. So I think, that for me, it's really collaborating as well as continuing to push our profession forward.
I couldn't agree with you more. It gets confusing if you have two different stances on things for sure, or we're pushing for two different bills, but not really coming together on it. And I think it's been excellent in regards to the way I've seen FPA and FSHP work so closely over recent years. And I'm so glad that you've been a big part of that as well. So I'm sure you work with Eric Larson well as president of FPA, and that can only help our profession. So thank you for all that. And then
He's actually been a great addition.
yeah.
It's really important to unite, because at the end of the day, we both want what's right for each of our industries. And he really has been a very collaborative and a lot of fun to work with.
Oh, that's great. Fantastic. So are there any specific events maybe you'd like to share that FSHP has coming up?
So yes, we have several exciting events coming up. Our annual meeting kind of remains our flagship event, but it continues to grow every year. Especially after COVID, we lost a lot of folks during that time. But we want to continue to bring together our pharmacists, students, legislators, and leaders across the state for some high quality CE networking, also innovative showcases. But this year, we're really adding a FSHP leadership conference so we can focus on leadership development, and that'll be happening in February. We also have a series of advocacy-focused town halls planned, designed to help pharmacists understand what our legislative landscape is happening and learn how to effectively engage with policymakers now that legislative days are coming up in January. You know that.
Right.
And even though it's not a physical event, I'm also looking to launch an FSHP podcast. And that's something that stay tuned for.
Oh, that's excellent. I love that. And I love the idea of a leadership event. We can all certainly use that. That'll be excellent. I tell people all the time, even if you've never been to a meeting, just go. It's so invigorating. The annual conferences are just so much fun. There's so much buzz around everything, and just so much great feelings and ability to speak with pharmacists from all over. It's just such a great experience. And I think FPA and FSHP do an excellent job, but they're a little bit different. So go to both. I think they're both excellent if you're able to. All right. Well, those are some exciting things coming up. And then I know that you're a very strong advocate. Obviously, we've been talking a little bit about that. We've got legislative days coming up for pharmacists. What are some of the priorities that you're looking at nationally, FSHP, to push this year?
So nationally, there's a major push to finally recognize the full value of pharmacists in patient care. Organizations like APHA and ASHP have been very active with CMS and new leadership this year. And really what we're trying to do is align to their efforts. On top of that, both national groups are pushing pharmacists to play a greater role in behavioral health and even chronic disease prevention, telehealth, and remote monitoring. I think these are the areas where pharmacists really have proven that they can improve outcomes. And so FSHP really is fully supporting that direction and see how we can continue to move that within our state as well.
Great. Excellent. And talking about the state level, is there anything else that we're looking at, especially with legislative days coming up, that we'll be advocating for?
The same thing. We're mostly backing. We're backing legislation that really establishes payment options for whether it's retail pharmacy or hospital clinic pharmacies. We're really working hand in hand with FPA on that. I think this is vital to really broadening clinical practice throughout not just our own healthcare system, but within our profession. And really, we're looking at increasing consultant pharmacy practice locations, particularly in physician-owned clinics that are linked to healthcare systems. I think these sites are going to provide great outcomes for both the community and within our health system. We're also looking at supporting PBM white bagging reform so hospitals can safely dispense medications and audit, modernize, build to safeguard pharmacists from unfair PBM practice. I think that's really important, especially on the resale side of the house. But we're preparing for expected legislation from Florida, and we're working with the Florida Hospital Association to further protect the 340B program, which is really crucial and critical for our access in our safety net hospitals.
Oh, that all sounds great. And we've worked really hard in regards to PBM reform. So it's good to hear that we're continuing to shape that and really get it to the point where best practices for patients, for pharmacists, for pharmacies, everyone. So that's fantastic. And what can pharmacists do, in your words, to really help push the profession forward? I know we've got legislative days, so they can certainly be a part of that. What else do you recommend to pharmacists?
I think, if you don't get involved, you don't need to run for office, but get involved. I think it takes a village to really make things happen. And the most important thing, if you can't get involved, then donate to the PAC. Donate to either the FPA PAC or a FSHP PAC, any organization that will help push our profession forward. The AMA and other than they really do a good job in fundraising and getting money for legislation. And sometimes that's the organization we go head to head on. And I think the more you donate to our PAC, the better we can then support our profession moving forward.
Yeah, and I've been pretty excited this past year seeing how we're working more with FMA, and I think that's great because we can only complement each other, just helping each other in regards to taking care of patients and providing care at the best, most cost-effective manner. So hopefully that'll continue, but we do have to have our PAC. We have to have people who are there supporting pharmacists and making sure that we're advocating. And like you said, if you can't run for office or have a lot of time to do what you're doing, for instance, just that donation can help others to be there. So such a huge part of our profession. Thank you. And, we talk a lot, or we've heard a lot about AI. In your perspective, what do you see and how that will impact health system pharmacists?
AI is rapidly reshaping hospital pharmacy by automating workflows, enhancing clinical decision support, improving patient outcomes, and even transforming workforce roles. But while the opportunities are significant, successful, adaptation, I think, really depends on thoughtful leadership, robust training, and a commitment to ethical and transparent use of the technology. I think pharmacists, more than anything, are uniquely positioned to lead this transformation, ensuring that AI serves as a tool to advance and, improve outcomes, not replace their expertise or their patient care mission.
Right. And it boils down to that. It's truly patient care. So there's all this information, but without somebody like the pharmacist to be able to provide that accurately and really, I think, have that holding hands for many patients. The pharmacist will be there to really show them the importance of their medications, when to take it, because we can have the best plans that's set by AI, but unless they have somebody who's really got their back, I feel like oftentimes pharmacists are that cheerleader to really be there and support them and help them understand the importance of the big picture, not just that one medication and some of the specifics such as side effects, et cetera. There's so much more to it. So, all right. Well, thank you. And then we've been seeing a lot of coverage regarding drug pricing and trying to get a handle on costs, of course. How has this impacted your world, and what is the outlook for drug pricing?
Oh, that's a
Loaded question.
Because drug pricing is significant, and not just for hospitals, but for retail to even try to make a profit today is just so hard. And even for our patients, so it is a significant and growing challenge for, I think, all pharmacies, not just hospital, driving innovation to help with cost management, but also we require constant vigilance, such as policy, products, and even the market dynamics, how they've evolved. The outlook is one of cautious adaptation and with focus on advocacy and really leveraging technology to maintain access and affordability for patients, especially with medication assistance programs, because it's not just getting more expensive for the hospitals, it's actually getting more expensive for patients to even take their medication. So, whatever we try to do what we can to continue to help in that manner so that patients have access to their meds.
Right. Again, it's that whole, we have a great plan, but if they can't take their medications, they can't afford their medications, it becomes a real challenge. And so this is another area that I think pharmacists can have such a huge impact to help with lowering costs and find the best possible medication for that patient. So, all right, well, thank you. And then at least I don't hear as much, and I think it's just maybe not brought up a lot anymore, but shortages used to be everywhere. We talk about all the shortages. Is that a big issue still right now for you all, and how are you handling that?
I think drug shortages, when I first kind of started, it was more like, I remember, God, when I first started as a director, maybe we had maybe 20 to 30 drug shortages a year, and we would, constantly change our stuff. But over time, now we really have, I guess, over 300 drug shortages out there.
Wow.
It's just become part of operations, constantly trying to come up with alternatives, switch drug treatments to keep our patients safe and help the treatments that they're needed. So it's just become part of an operational issue. So people aren't, it's part of pharmacy. So it's not
Yeah.
like we're not going to kind of sit here and complain, but it's just the market dynamics. They price the generic so low, they mark, the drug companies then close out of what they can afford to make the drug for if they can't afford to make a profit. So it's just become a huge issue. I think one of the things that we have done as an organization is we actually, joined Civica and became a founding member of Civica RX.
Oh, wow.
And that has really helped us on the hospital side because what they do is actually manufacture all those shortages that are out there. And at least we have a safe way for us to continue getting the meds we need when things come into shortage.
Oh, that's great. And I didn't realize that. So can you explain Civica just a little bit more to our listeners?
Sure. So Civica is like a nonprofit manufacturer that is owned by several healthcare systems across the country. They are not for profit, and it's run like a P&T board. Everybody decides which drugs we should manufacture, or the ones that are really the most in severe impact and shortages. And they've been amazing. If you want to go ahead and look them up, it's
That's great.
civicarx.org. And, I think it's a great way for health systems out there to support at least a manufacturing company that, is going to be there and is not there in for just the profits, but to make sure that we have drug sustainability throughout for our patients. That's really important. They're actually also coming out with Civica RX for retail side of the house.
Oh,
So
wow.
it's really an exciting, you guys should look them up. It's really great.
Sure. And we'll put that link in our show notes too. That's fantastic. Thank you for sharing that. And so I have alumni who contact me from time to time looking to make a switch from community pharmacy to hospital pharmacy. What do you recommend to those individuals?
Well, for pharmacists transitioning from community like to a hospital setting, I recommend, even while you're working for retail, pick up a per diem position, and that really helps you pursue into that training while you're still working in community pharmacy. Don't wait until you are so fed up that you don't want to do it anymore. Even if you pick up a couple of weekends a month or one weekend a month, it really helps you with the switch, which can be very challenging due to the significant practice difference of hospital pharmacy versus community. But it really is an important to be certain about your decision before you decide, yeah, that's what I want to do. So hospital pharmacy really involves a wider range of treatments than community pharmacy. So maintaining those clinical skills are really essential. And I think just starting with, you can reach out any local hospital that you live close to, and ask to be a per diem pharmacist. A lot of them will take it. We always do that. And I think it's a great thing for us to keep our pharmacists, up with their clinical skills. But it really helps the hospital in the end when we have shortages or somebody can't make it on a weekend or even for a vacation. It really helps for us to then fill those slots.
Oh, that's great. That's a great idea. There are quite a few PRN positions I've seen posted. That's excellent. We talk a little bit about community pharmacy, and is a little bit of frustration there. I really think if we can get a handle on pharmacists getting paid for their services as they should, and then really taking it to that next level of being that true ambulatory care pharmacist there in the community to be able to provide some of those test and treat options. And of course, we provide immunizations, but there's so much more we can do. I just see this evolution coming, and I'm hoping pharmacists see that too, and they hold on, because I think both practices are excellent. We just need to shape, I think, community pharmacy a little bit more in regards to really being able to practice as we've been taught, because there's so much more they can do.
And
But that's a
I think even with preventative care, imagine, you got to
absolutely
think about the pharmacist is the most accessible healthcare provider to anybody, more than a nurse, more than a physician. You can just go to a community pharmacy and ask to speak to that pharmacist because you're having some issues or you want them to get guidance on even supplements, anything that you're looking to
right,
do. They're right there. You don't have to make an appointment. So,
right.
people need to use their pharmacist, whether they go in the retail or even in our clinics, anywhere. It is the most accessible healthcare profession out there.
Absolutely. Couldn't agree with you more. Well, thank you, Madeline, Dr. Camejo. Is there anything else you would like our listeners to know before we end the podcast?
Well, a few things. I think I want every pharmacist and pharmacy professional to hear is simple. Your voice is essential. It's really important. Every one of us, students, technicians, residents, seasoned leader, has a role in shaping where our profession is going to go next. I think we're standing in a moment of real change. New care models, new therapies, and national recognition for our value is really happening right now, but none of it is going to move forward if we stay silent. I think stay engaged, show up, advocate, and invest in those coming behind you. Because if we don't lead those conversations, others will decide our future for us.
Absolutely. And there are some amazing pharmacists who are out there doing some incredible things. I think especially we see that in some of our independent pharmacies and what they've been able to do and help with patients. And so and to progress the future. So go out there, find a mentor, somebody who can help you to understand what to do and how to lead and how to push the profession forward. And people like you, Dr. Camejo, I think are an excellent example of that. And I'm sure you get young pharmacists all the time wanting to talk to you and get your advice. So we really appreciate you taking the time here with us today and providing some of your advice.
And thank you for having me. I've enjoyed our podcast, and I hope our listeners take home a good message.
Absolutely. And I'm looking forward to your podcast. I'd love to hear that. We can connect. Well, thank you all for taking the time to listen today. If you want to support us, please don't forget to subscribe to the podcast as well as the YouTube channel. So take care, everyone, and happy Thanksgiving.